good to see a good big crowd here first thing in the morning. Thank you for joining us. So we're going to talk about ChatGPT. We're going to explain a little bit about what it is, but also our thoughts about how it can be used in plastic surgery. So I invite you all to download our article that's on PRS Global Open. You can use the QR code here. Of course, all the other fantastic articles on PRS Global Open. And we're actually, this session will also be recorded and available on PRS channels. So please take a look at the article. I'm going to hand over to Dr. Oleck, to Miranda, who's going to talk a little bit about the basis behind ChatGPT.
Great. Thanks, Dr. Patel. So we've all been hearing a lot about ChatGPT and its applications and future implications across essentially all fields and industries. And as with any major technological advancement, there's a mix of excitement and skepticism and overwhelming amount of uncertainty. So my goal here is to define, contextualize, and demystify this technology in the talk with the aim of elucidating not just what it can and can't do, but providing a framework to understand how and why it has those capabilities, as well as offering some tools to make the most of the technology while minimizing errors for your own practice applications. I'll begin by defining large language models, or LLMs. So language model is a computational model that assigns probabilities to words. So for example, a language model might tell us what the probability of the next word is in a sentence, given the previous words in a sentence. So more specifically, it predicts the tokens, which can be words or parts of words, and include numbers, punctuation, and even the spaces in between those words in a sentence. So how does a language model learn to predict the next token? So first, it's transformed into a vector, which is a numerical representation of the token. So you can think of the process of turning a token into a vector as finding where a word belongs in space, where vectors that are closer together represent tokens that are more similar. So recent advances in deep learning models, such as transformers, are very good at turning tokens into meaningful vectors, which the model can then use to predict the next token. So why does this task of predicting the next token make the models flexible in their ability to reason with language? So it might seem like it wouldn't be sufficient to just be able to predict that next word, but it turns out that predicting the next word is not an easy task, and the models need to encode a lot of information and reasoning in order to be able to do so. So here we have an example sentence: minimizing tension when reapproximating skin edges helps optimize the formation and appearance of blank. So it may be a somewhat obvious guess that the next word could be scars to those who have some background in plastic surgery principles, and many of the folks here. So for other individuals or for a large language model, it stands to reason that it would also require a fair bit of training to be able to make that guess. So next word prediction has been around as a tool for years in building large language models. So it makes ChatGPT and other recent LLMs like Google's Bard different from the others. So the first reason is that LLMs today are simply just much larger than their previous models. So we measure the size of the models by how many parameters it has. And parameters are ways that the model can modify the input to produce an output. So in this case, the next word. As an example, in the equation for a line we may all be familiar with, y equals mx plus b, x is an input and m and b are parameters for this model. So as we change m and b, the value of y, our output, then changes. So LLMs these days have billions of parameters. The first version of ChatGPT had 175 billion parameters, whereas just 5 years ago, some of the largest large language models had roughly 100 million parameters. In order to train such large models, OpenAI and others have trained models on a very large corpus of text taken from the internet, including sources like just the entirety of Wikipedia, to name one. So ChatGPT 4 is in fact rumored to have about 1 trillion parameters. So why does it matter that the models are larger? Well, it turns out that so-called intelligent behavior emerges as the models get larger. And as you introduce billions and billions of parameters, the models are able to perform tasks that it was unable to perform before. So this finding is the reason why there's such a race to make larger and larger models. So the second difference between ChatGPT and prior LLMs is instruction fine-tuning, which is a process that trains a model to answer different types of questions. So as I mentioned before, the main task that LLMs are trained to complete is to do next word prediction. However, when you interact with ChatGPT, it's actually able to follow instructions and answer questions. So to give an example, if we take the following prompt, explain the advantages of a deep flap over a tram flap, and we put it into ChatGPT, we would expect it to follow those instructions. However, when I tried entering it into a version of GPT that had only learned to predict the next word without any instruction fine-tuning, I can show you what happened. So you can see that it auto-completes the text. It includes things like a Q&A section. So this auto-completion makes it look like it's just pulled from a text bank somewhere online, which it likely is. So in particular, it did not follow the instructions that I gave it, and the responses themselves are lacking in quality and coherence. So what people used to do prior to instruction tuning to get around this issue was to try to trick the LLMs to answer questions by starting the answer and having it sort of auto-complete. So you can see by tricking the LLM here, by starting the answer with a prompt, there are many advantages of a deep flap over a tram flap. Historically, tram flaps, we can take advantage of next word prediction by prompting it and beginning that sentence. So we can still see some strange artifacts here, like a citation number that was generated, and it's still not quite as nice as ChatGPT, but it is a bit of an improvement. And then finally, when inputting that original prompt with instruction fine-tuning implemented, we can see that it does actually answer our question. So the prompt describes the advantages of a deep flap over a tram flap rather than just spouting facts about the flaps. So one thing that I think is important to address is that there's a fair bit of research that suggesting that models like ChatGPT cannot reason or that it can get some simple questions wrong sometimes. That is certainly true. However, there are many ways that you can try and get ChatGPT to have some better context to answer your questions. So in this paper, the author found that there were several logic questions that GPT-4 appeared to consistently get wrong. So ChatGPT utilizes a process called reinforcement learning from human feedback for its classifier fine-tuning, in which the model would perform a task and generate a response, and a human or a very advanced model will select the preferred answer. Then the model will adjust accordingly and learn from those choices. So we need to remember that ChatGPT was trained initially to give the most likely next words, not necessarily the most correct. So when you test with human feedback, you leave room for human error. So correct answers aren't necessarily going to be what people select. And the problem with reinforcement learning from human feedback is that people tended to gravitate towards answers that were more confident, not necessarily more correct. And that leads to the phenomenon of ChatGPT providing answers that are confidently wrong. So, however, other researchers have since found that if you prompt the models in the right way, you can actually get some better results. So one such method that we can use is known as chain of thought prompting. So in this example, we might want to teach the model to try and answer some simple math questions. ChatGPT is notoriously bad at things like arithmetic. However, the authors of this technique found that if you include some text about how to arrive at the right answer, ChatGPT is able to replicate that thought process and become more accurate. So we can counteract some of that built-in tendency towards more confident responses and put in some safeguards to improve the accuracy when we give custom instructions for ChatGPT and prime it to give high-quality information. So similarly, just by telling the model to take a deep breath and work on the problem step by step can increase the accuracy of models from some baselines of 34% accuracy up to above 80% accuracy. So the leading hypothesis for why this happens is that by telling the model to take a deep breath, it may mimic some content on the internet that's more likely to be detailed or protocolized or accurate, although it is difficult to know exactly why this helps, and researchers are currently trying to figure out how to automatically craft some prompts to produce the best results. So ultimately, I like to think of this phenomenon as a sort of parallel to how human beings interact with and teach one another. So as a fourth-year med student, I've had sufficient practice with confidently delivering an incorrect response whenever asked by a question by a resident or attending. But when prompted to actually walk through how I arrived at that answer, I'm encouraged to actually engage in critical thinking, which may lead to a more thoughtful and likely more accurate response. So in ChatGPT 4, you can put in your own custom instructions, such as work on this step by step, or show me the rationale for this example, to be delivered for every prompt automatically, or you can write them in for each prompt manually and experiment with some different modifications and see what results you like better. So because the model functions by feeding in a string of words, predicting that next word, and then feeding that cumulative combined string back in, and so forth, prompting the model to sort of walk through its process precipitates more cycles of computation and increase the likelihood of accuracy. So now that we have a brief overview of how ChatGPT works and what sets it apart, let's just briefly dive into some of the size and scale of it today. So GPT's first iteration without any instruction fine-tuning was developed in 2018, and then ChatGPT 3.5 with the instruction fine-tuning was released to the public 1 year ago, where it took the world by storm and gained 1 million users in less than a week. So the most recent iteration, GPT-4, was released on March 14th of this year, and currently there are over 100 million users estimated with about 1.6 billion monthly website visitors. And it's estimated that ChatGPT 4 is trained on as many as over 1 trillion parameters, which suggests that the training data for the latest version could be about 6 times larger than the 175 billion parameters used for ChatGPT 3.5. And OpenAI also reports that the newest version can produce up to 40% more factual responses compared to prior. So with that, we can transition to the rise of ChatGPT across the medical community and what that means for our field.
Thank you, Miranda. My name is Nick. I'm a plastic surgery resident at Duke. As Miranda mentioned, ChatGPT has been in development for quite a long time now, but it's really only over the past year that the medical community started to take notice. For example, if you did a PubMed search for ChatGPT in December of 2022, you'd end up with a grand total of 4 results. So that same search today, about 10 months later, will give you over 1,500 peer-reviewed articles. And as of September of 2023, articles with the term ChatGPT in the title were being published at a rate of over 200 per month. So what has driven this massive interest in this technology across the medical community and in plastic surgery? Well, the model has demonstrated some pretty impressive feats during this past year. It was able to pass the USMLE Step 1 without any clinician input, and this including providing detailed reasoning behind its answer and why it came to each answer that it did. It was able to write convincing scientific abstracts that were indistinguishable from human-derived text by peer reviewers. And then even on our own doorstep, ChatGPT was able to outperform certain residents on the yearly plastic surgery in-service exam. I'm personally seeing an application here. Maybe we can bring ChatGPT on for the Duke Resident Bowl match later on today. But, in seriousness, you will see that in the news and across popular media, there has been countless examples of different accomplishments that ChatGPT has demonstrated in this past year. But I think when I really started to appreciate what this tool can do and its power and promise in plastic surgery is when I started messing around with it myself. So rather than list these off to you today, I'd like to show you kind of how this thing works and what it can do. So in starting, I turned to ChatGPT to prepare for this presentation. I said, I'm giving a 40-minute talk on ChatGPT in plastic surgery. The audience will be plastic surgeons, residents, and medical students from around the world. Can you please give me a detailed outline so we can, put together this talk? And as you can see, literally in seconds, ChatGPT can give me a detailed outline highlighting almost everything you've already heard and what you will continue to hear during this talk today. I can ask ChatGPT to expand on any of these individual sections, and it will go into more detail, help me generate more ideas, and create an even more in-depth talk. Further, I can alter my prompt and give a different audience a different level of expertise, and it will adjust accordingly. So did ChatGPT write the words that I'm saying to you right now? Well, no. But I'd be lying if I told you that we didn't lean heavily on this outline in preparing this talk for you today. So that's kind of a fun and interesting example, but what about something a little more relevant? So this weekend at Plastic Surgery, the meeting, there's going to be a ton of excellent research presented. And as a resident, one of the hardest parts of completing a research project for me is finally sitting down and getting the time to write that discussion section. So in this example, I turned to ChatGPT. I said, here's the results, including my statistical analysis of a research paper that I wrote. Again, can you please give me a detailed outline of a discussion section? And as you can see, again, we have a beautifully laid out discussion here with different points specifically highlighting areas of my results that should be highlighted in the discussion. It even mentioned some limitations that I didn't ask it to do, and even offered places where a figure or a table may be helpful. And then taking it a step further, I even asked ChatGPT to help me write a structured abstract that could be presented. And again, this is just using my results. And it gave me a pretty decent response where it also included some keywords that, again, I did not ask it to do. It kind of came up with that on its own. But what about ChatGPT in clinical plastic surgery? So in my mind, one of the most obvious applications for this tool is patient education. I'm imagining a dynamic interaction between a patient and this tool where the user can get additional information, ask follow-up questions. So in this example, I asked ChatGPT, I said, I'm a patient interested in abdominoplasty. Can you please walk me through kind of the steps of the procedure, some of the risks and benefits and other things that I should know? And ChatGPT, again, gave me a very thorough response here. See it coming up in just a second, but it kind of went through everything I asked for, the steps of the procedure, risks and benefits. It even highlighted things like seroma formation, venous thromboembolism, and the use of drains. And obviously these are things that we all know are very relevant to our discussion with patients when we're talking about abdominoplasty. But as we know, the problem with a lot of our patient education materials is that they're often far too complex for many of our patients to understand. Patients come from all different backgrounds, and not everyone is not a one-size-fits-all pamphlet we can hand out. So I think that ChatGPT kind of definitively solves this problem. So later on in this kind of interaction with ChatGPT, I said, thank you for the information, that's great, but this is a little too complex for me. Can you rewrite this at an 8th grade reading level using less complex medical language? And it's able to do this instantaneously, maintaining its key points, but without going in too much detail or using medically complex language. So if you've been paying attention to our literature, plastic surgery is definitely not an exception to that uptick in publications over the past year. So one recent study found that ChatGPT could generate well-structured, comprehensive answers to patients' questions about breast augmentation, very similar to my abdominoplasty example. Another study had ChatGPT generate frequently asked questions for autologous breast reconstruction, including both the questions and then answering its own questions that theoretically could be given to patients. And this was rated as 95% accurate by the authors of the study. And then if you think about this, maybe one day can ChatGPT take over our entire pre-procedural consultation? Well, I don't think we're there yet, but one preliminary study simulated this, looking at the top 5 non-surgical and surgical plastic surgery procedures and simulated a back and forth with a theoretical patient. And again, they assessed this as accurate and appropriate responses from the model. So what has it done in plastic surgery research? Well, one study asked ChatGPT to develop novel systematic review ideas related to aesthetic surgery. And when the authors cross-checked this with a manual review of the literature, they found that over 75% of these ideas were in fact novel and had not been published previously. Another study took this a step further, and they said, what if ChatGPT can do this entire systematic review for us? Can we automate the entire process? And while the authors expressed some trepidation here, they were cautiously optimistic and said maybe the model is not there yet, but I think this is an area that is ripe for automation, and it certainly can be an application for ChatGPT in the future. And then finally, the model has even been shown in a proof of concept fashion to assist with R01 grant writing, including developing specific aims, hypotheses, and potential global impact statements. So as you can probably tell, I'm extremely excited about this technology in plastic surgery. And when I went to Dr. Patel with the idea to write a paper on this, I originally pitched it to him as, let's write a paper of all these incredible things that this tool is going to do. It's going to revolutionize our field. We need to start writing about this right now. And what Dr. Patel did, as all good mentors do, he saw the kind of stars in my eyes and encouraged that excitement and interest, but he also gave me some much needed perspective and encouraged me to take a step back and look at the bigger picture. Because when you think about it, what we have here is a rapidly developing technology that we are really, especially in the medical community, really just starting to understand how it works, why it works, and what it can do. So I think the real story here is how can we implement this safely, ethically, and with our patient's best interest in mind. So that's where we decided to go with this paper, and I think that was a very wise choice. So Dr. Patel is going to dive into that a little bit more now.
So Nick talked about a lot of the different uses of ChatGPT, and I think some of the exciting areas are related to your research, education. But when we think about many of the uses of this technology and how it may interface with patients, I think there are some similarities to what I've seen over the last 15 years with things like electronic communication, social media, and telehealth. And any interactions with our patients, we need to kind of rely on the pillars of biomedical ethics. And just as Nick was getting excited about ChatGPT, I was also trying to understand what was this technology, but couldn't really figure out, well, if we're seeing that there are lots of disadvantages to this, how is this technology built? And I'm not, unlike Miranda, I don't have a master's degree in computer science to understand any of this stuff. So I relied on the experts in my institution. I'm fortunate to be in an institution where I just sent some emails and had a meeting with one of our colleagues here in the Department of Computer Science, Dr. Bowen Dingras. He's one of the co-authors on our paper. And Dr. Dingras is actually an expert, an internationally renowned expert at large language models and artificial intelligence. He also is not just a professor of computer science at Duke, he's also a research scientist for Google. And he explained to us, what are the flaws with something like ChatGPT. And together with his insights, we decided to apply the four main pillars of ethical use of biomedical ethics to the use of an intelligent chatbot, particularly focused on how it would interface with patients. So the first principle that we're going to discuss is the principle of autonomy. So autonomy is really the respect for the patient's right to self-determination. It's not difficult to imagine ChatGPT assisting with some of the more mundane tasks of clinical practice, which include screening, electronic patient questions. Anyone who uses Epic probably gets a whole bunch of those patient questions forwarded to them, scheduling appointments, and even providing support and answering questions to patients who are going through some difficult times. Some of these things have actually already been done and applied. Early this year, as part of an experiment, an online mental health app called Coco transitioned from actually using human therapists who are interacting with patients to using an AI chatbot without notifying the users. So when the users found out, there was clearly some consternation, and they felt like they were betrayed by this organization. So clearly, a similar oversight in plastic surgery would be unacceptable and would definitely erode the trust of our patients and that patient-surgeon relationship. So we believe that it's really critical that any interaction with a patient has with an AI chatbot must be consensual. The patients have to understand that they're interacting with a chatbot, not a surgeon or their designee. The next principle we're going to talk about is the principle of non-maleficence. So that's the duty of a physician or a healthcare provider to do bad. One of the key points that Dr. Dhingra stressed was that ChatGPT may give the illusion of intelligence. I mean, it's in the name, artificial intelligence, but in its current form, it can't be relied upon for any degree of accuracy, especially for specialized or technical topics like plastic surgery. So our second ethical principle that we're going to discuss follows that patients should not be encouraged to use AI chatbots for information gathering or medical advice in any form. So what do I mean by that? So the authors of a recent study on the topic highlighted that from a distance, ChatGPT output can mimic and pass as authentic, but when you look at things a little bit more closely, it becomes apparent that the output from ChatGPT is based on material that doesn't have any depth of understanding. So it goes back to what Miranda was talking about being confidently wrong, and it will give an output that looks like it's well thought out, but it has incorrect answers. A recent PRS Global Open study examined ChatGPT answers about basilar thumb arthritis and found that the chatbot is often not able to provide references for any of the information it provides, or may actually confabulate references that don't even exist. So in the future, the kind of thing that we'd be interested in is a chatbot being able to assign a level of confidence for a provided answer or an accurate list of supporting references. But in its current form, it can't be relied upon for any accuracy or completeness, and definitely should not be used by patients for information gathering because of these inaccuracies. Next, we want to talk about beneficence. So that's the ability to do good. So one obvious example for the use of ChatGPT, as Nick had alluded to, is clinical documentation, which includes things like mundane tasks our residents are always called to do, which is discharge summaries or post-procedural instructions, or even creating information pamphlets for patients. So in this scenario, while we don't have to worry about our patients gathering incorrect information directly from the chatbot because we're providing it to them, it's imperative to understand that documents that we create based on output from ChatGPT may still contain misleading or incomplete data. So the principle of beneficence, as I said, acting in the best interest of the patient, demands that any information that we provide to the patients is as complete and accurate as we can make it. While recent studies have shown that ChatGPT can successfully generate discharge summaries or post-op instructions, they don't currently meet the standards for clinical deployment without any human intervention. It's important to remember that ChatGPT was trained on data before 2021 and therefore doesn't have access to the most up-to-date literature or information about the procedures. Additionally, the majority of medical literature exists behind subscriptions or paywalls. So what does that mean? So that means that ChatGPT only has access to publicly available abstract or summary. So in order to provide comprehensive evidence-based clinical documentation or guidelines, all ChatGPT-derived materials have to be thoroughly reviewed and approved by a clinician before they're deployed in a clinical setting. And the final principle we're going to discuss is justice. So justice is effectively treating all patients equally. ChatGPT is trained on a massive volume of internet data, which includes things like message boards, forums, and comments that could be inherently fraught with bias. So that the current model is actually prone to producing answers that align with the most represented demographic or viewpoint expressed in that data set. So simply put, ChatGPT is going to amplify what's already frequent and dampen what may be a less common perspective. So while OpenAI, which are the people who created ChatGPT, have taken steps to mitigate the risk of bias and examples of things that may be discriminatory or politically biased responses, it still produces things like that. So because of this, plastic surgery patients who may be from underrepresented or minoritized groups interfacing with ChatGPT directly may develop materials that generated by ChatGPT that have information that's inaccurate, irrelevant, or biased. So again, imperative that we take a close look at those materials before they're deployed directly to the patients, because otherwise we could be perpetuating some of the disparities that we see in practice. So I'm going to hand it back over to Nick to talk about where do we go from here.
So we really covered a lot today. I hope you kind of learned about how ChatGPT works, how it's already being implemented, and how we can do this safely and ethically. And if I could summarize, what I hope the key takeaway would be, it would be similar to what Dr. Patel had said to me when we first started talking about this, and that is that we should be excited, we should be educated on this topic, but above all, we should proceed with caution. So I think that in the future, safe and ethical implementation of AI chatbots like ChatGPT is going to require institutional buy-in and forward thinking. And we're very fortunate to be at an institution that is part of the many institutions that are leading the way in this. Duke Health recently announced a 5-year partnership with Microsoft back in August, and they've already begun work on developing ethical, evidence-based, HIPAA-compliant solutions to integrate this tool into our daily practice. And this includes things like AI-generated op notes and clinic notes, from that to everything like a quote surgery GPT, which is specifically trained on evidence-based data. And while I'm not really at liberty to discuss more of the details on this, I could say that I think starting at this level, making sure that we're not doing this on an individual basis, plugging information into ChatGPT and seeing what we get for our patients, I think starting at an institutional level is critical. And it's going to take institutions like Duke and the many others that are doing this to help us lead the way and make sure we're doing this safely. And with that, we'll wrap up, and we're happy to take any questions.
I guess one of my questions is, and you kind of alluded to this in terms of the future of how institutions and physicians can guide AI responsibly, but what do you think the role, if any, should be kind of now in terms of counseling? Because patients are going online and they're using ChatGPT or Bing, and as you said, there's a lot of limitations, although there's a lot of promising areas. But should we be doing anything to counsel our patients now on some of those limitations and cautions?
Yeah, excellent question. I think we absolutely have to do that. We're already faced with patients who are looking on social media. There's been a number of studies published in PRS and Global Open and among other journals across a wide variety of plastic surgery-related topics, which show that the information that patients are already finding from social media are inaccurate, mostly from patient-generated sources, and even from physician sources, they're not always well vetted. And then, of course, when we add in ChatGPT, which seems like a much more legitimate way for patients to find information, I think they're going to put more reliance on the information they get from that, thinking that it is accurate, because it will produce things that refer to institutions or produce references, which might seem like it's much more scientifically based than a video that they watched on TikTok. So I certainly always advise my patients, don't rely on the information that you see on the internet. Like, if you have any questions about anything you've seen, they nearly have always nowadays looked at some of those things, and then I kind of try and bring them back in and talk about some of the inaccuracies and really kind of reframe that. I think it's harder on a broader scale because how do we educate patients before they've come to see us when they've already looked up things? And that really behooves us as a field to try and produce high quality information that's out there. Using, if we're going to use something like ChatGPT to produce patient-facing education materials, we have to really thoroughly vet it and then post that and make that information available. I mean, Miranda can probably speak to how if we, as a specialty and all specialties in medicine, start to produce better information on the internet, then things like large language models will become more accurate because that's what it's trained on.
Exactly. I think as Dr. Patel said that, and as Nick described too, the information, the data that is used for training ChatGPT is only going to be as high quality and accurate as what is on the internet already. And it's compiled in a way that I think in a lot of ways, it is more comprehensive than what people might find in various places on the internet. And I think patients reserve the right to do their own background research if they make an appointment to go see a plastic surgeon and it's months out and they have questions. And I think the accessibility of it is a really important thing. But we're not at a place right now where we can rely on the quality of the information and really back it up and for the public yet. So I think as ChatGPT continues to partner with institutions, I think that'll help because that will also enable usage of academic text and research that is behind those paywalls. So while OpenAI is just using publicly sourced information, when there are partnerships with academic institutions, there's then access to academic research materials, and I think that'll help propel us forward as well.
And I'll just add, I think it's important for all of us to be educated on this topic for that reason, so we can address this with patients. And kind of like I mentioned, until I really sat down and spoke to Miranda and Dr. Dingra about this, I definitely did not understand how this thing worked. And then even more so when I started using it, I fed it in-service questions for fun to see if it got it right. And some it did, but some it would give me an answer and then give me 3 paragraphs about why that was the answer, and it was entirely wrong. So I think understanding that is a possibility when patients are asking questions is really important, because I don't think a patient could pick that up, but we definitely can.
One thing I want to add is that we're not advocating being naysayers and not using this technology. The more seasoned surgeons who are here will remember when social media first came up and how we were very worried about use of social media, and now it's completely mainstream and how it's accepted, but things have to be implemented in the right way, and that's what we're really advocating for when we're talking about things like AI chatbots. This is going to be the future. You can see with the massive uptake in interest and usage across a variety of fields that this is going to become the mainstream. This is going to be widely utilized, but we still have a duty to protect our patients from information that's inaccurate and potentially could cause them harm.
Thank you all for doing this. This is really cool. And if you look around, I think this is really clear evidence that what you're doing is important and matters. I might have a two-part question. The first is just a curiosity. How enthusiastic are you that we will, as a society of plastic surgeons, be able to acknowledge that what this information should be compared perhaps up against in super scientific literature should be fact, but for stuff like marketing or information or education on our websites, the bar will clearly have to be different. And how enthusiastic are you that we'll be able to meander our way through that challenging thing? Ash, I'd love your thoughts on that.
Yeah, excellent question. I think clearly there is a difference between what we use for educating our colleagues and for science compared to the information that's patient-facing. And it is difficult to put together all those patient education materials. So I think these kinds of tools will be really helpful to collect information, to help compose that information. And what's nice about this is that every plastic surgeon could potentially use a GPT engine to produce their own specific patient education materials for their practice, but they have to make sure it's vetted and doesn't have things that are inaccurate. I think as the body of information grows, as we're using that more and more, things are going to get much more accurate over time. I think we're definitely going to see a change. By this time next year, I'm sure it's going to be much more widely used. I mean, when we were in Boston last year at PSTM, this wasn't even on the radar of anyone, and here we are with thousands of publications already in the literature in the space of a year. So I think that there's many applications, as Nick talked to, but certainly from the patient-facing side, we just have to be a little careful about the accuracy of some of the material, but the more we put out there, I think the better it's going to get.
And then my second question is a technical question, which is you chose ChatGPT, and Bard to me seems like, or the Google products seem to be like the nearest competitor. I'm just curious whether you think something that actively crawls the web like Bard versus something that historically does but has this super complex that you talked about string of way to get to the answer. Was ChatGPT the only, or was it like, I don't know, which one should we use?
All right, so I think for this research, we were looking at ChatGPT specifically, and that's also where we're just seeing the most excitement and usage. So I think that reflects the general population's usage and understanding of the technology, so just being a lot more widely used. And Bard certainly has a lot of capacity as well, and is very promising too. I think ChatGPT has a much larger scale at the moment, and they've been, I think ChatGPT 3.5 really was something unlike we had seen before, and I think that was why it really did hit 1 million users in less than a week and continue to grow so rapidly. So even though it's releasing version by version, I do think, and we don't know what ChatGPT 10 is going to look like or anything, but I do think that it has like a lot more capacity and just has the momentum right now. That's why we're seeing it used above other technologies, and that's why we're seeing that generated excitement in the research community as well.
And interesting, there's a number of different companies who are looking at this, as you alluded to. New ones come up all the time. But a few months ago, there was even a congressional hearing where the people who run these companies, tried to introduce a measure of control over the use of GPT engines and AI, because they're just worried that it's like a snowball that will run out of control. That we're already facing lawsuits about the use of copyrighted material. Artists, recording artists, even people's voices in certain AI engines can be taken and completely used. So I think it's a really fascinating field, because even as we talk about the use of scientific material, things that are behind a subscription wall, now what happens if that all of it comes out, the information from medical journals that are peer reviewed but copyrighted are started to use in material that are widely distributed.
Thank you. That's really cool.
Hi, my name is Eric. Sorry. I'm a plastic surgeon from Mexico. I'm also a professor of plastic surgery. I just asked ChatGPT what are the negative points about this in residents or plastic surgeon students. And he told me this. Technological dependence. I think one of the most important concerns about that is they might reduce their ability to develop clinical skills and make independent decisions. Errors in the ChatGPT, privacy and data security, cost, and job displacement. What do you think about that?
That's an interesting response from ChatGPT. I think that when we think about the applications of artificial intelligence as a whole across medicine, there are definitely going to be some areas where there is job displacement and a change of things. We just think about, I think less so in a technical specialized field like plastic surgery, but I can imagine radiology, like routine screening studies like mammograms, will be completely taken over by AI engines, because there's already data that shows that the computer is more accurate than a human being, has a lower error rate. I think it's not going to be possible for a computer or a machine to do surgery and think about things in the way that we do, at least not in our lifetimes. I do think that for education, something like ChatGPT has a real benefit to education for the residents. I don't like to think I'm that old, but when I was a resident, we only had the hard copy of books. The information wasn't on the internet. You couldn't search for things in the same way. And now the availability of knowledge for learners is so abundant that it can be actually confusing for them, because there's too much information that our residents have access to. They don't know which sources to necessarily go to and rely on. But something like these AI engines can help steer them and summarize information to allow them to get some foundational knowledge in a much more effective way. But that's, I think what's really important is to have these discussions and to think about how should we implement technology like this in a way that's going to benefit us in the long run and not create some kind of problems that are unanticipated.
One of the things that we discussed in our paper relative to education for plastic surgery residents is trying to find ways where we can flip the script, and instead of asking ChatGPT for an answer, so with the concern being that if we're just relying on it to give us information, it could be inaccurate, and then we're not thinking about it ourselves. One of the things we talked about, and I've tried to do this, is asking it to act as a board examiner and give it a case and say, can you prompt me with questions, and I will answer the questions, and then you just continue to prompt based on my answers. Now, while that still may require some level of medical quote-unquote knowledge from ChatGPT, I think it's much less. And in that situation, you're using it as a conversational agent, which is more of its intended form. So I think that is one of the many applications where we can use this to improve our education rather than it being a hindrance.
And I think the other thing when it comes to cost, there really is a low cost barrier for this. And so when I think about education globally, something like this technology could actually really benefit people around the world, where we're fortunate in institutions like the one I work at, where we have lots of resources, we have access to all the information, but some of our colleagues around the world, and certainly trainees around the world, don't necessarily have access to all the textbooks and the information that people like Nick have. So how do they get all the up-to-date information? Well, something like ChatGPT or these similar engines could help provide that for them.
Hi, I'm Anshami. I'm a research fellow at University of Miami. Since I'm doing research, I also use ChatGPT for a couple of things, but I wanted your take on how you use ChatGPT, or have you ever used it to perform any statistical analysis with the plugins and extension the ChatGPT 4 has? And the second question is, Dr. Patel already mentioned that it sometimes fabricates citations. So have you ever used it even for citations for abstracts? Because I've found them wrong most of the times.
I've certainly tried both those things. I've started messing around with the plugins a little bit. I know, like Miranda mentioned, and she can speak more to this, but I know the model is notoriously poor at mathematics. But with some of these plugins, there's the potential that maybe that will improve that use. I definitely have tried to see if it can create references, and I think actually it's interesting, even in the time course between when we started preparing for this talk, the model has improved significantly, and they've put in some stopgaps, so it will much less frequently give you incorrect references, but I still personally would not rely on it at all for that use.
Right, and just to add on to what Nick was saying, the model is not intended to, it's not trained on references specifically. So references, URLs, and mathematics are areas that ChatGPT is not specifically pre-trained on. So it can improve, and the plugins can be specialized to help with those specifically. But overall, it'll create citations based on what a likely citation could be based on the string of words and context. So it won't be correct because it isn't intending to do so. It's intending to come up with coherent sentences and paragraphs in the structure that you prefer. So I think as we've discussed, the very useful part of it for research and for clinical practice now is just eliminating some of that just the grunt work of just the writing itself. So I mean, at least for myself, editing takes a lot less energy than writing, and finding the references and backing up your claims with them and everything. I feel like it takes away some of the steps involved in the planning and the outline. So I think by streamlining that part of it, it won't necessarily replace the work and create your entire systematic review for you, as much as some of us might want that at times. It does help streamline that, so the majority of the work is just the more rewarding parts of it, and not just the summarizing and laying out the framework.
And I'll just add to that by saying right now I don't think the models are good enough to be used for scientific writing, and certainly not to produce accurate citations, things like that. As I mentioned, maybe a year from now, maybe it will be, because that's the pace of evolution. But there are publishing guidelines that already exist. Our journals have them about the use of generative transformative engines like this. That you have to state that they can't be listed as an author, but you have to state that you use them.
Thank you.
Thank you. And that's all the time we have. So thank you everyone for coming out. We really appreciate your attention.